welcoming Chris Zaleski. Chris is a pharmacist at Nebraska Medicine across the street, and he'll probably tell you a little bit more in his presentation about what he does here. So please help me in welcoming him.
All right, thanks, Judy. Can you guys hear me okay? Awesome. So like Judy said, my name is Chris, and I'm a pharmacist across the street at Nebraska Medicine. Specifically, I'm a pharmacy supervisor, and part of my role is to manage our technician team. So we have quite a few technicians on staff. We have, I believe, 23 full-time technicians that work every day, Monday through Friday, and a variety of part-time and casuals as well. So it's a good role that has been really rewarding for me. I've gotten to know a lot of really awesome technicians, work alongside of a lot of them, and I want to really kick off my presentation by really talking about what I think is the most important thing in the pharmacy, and that is the technicians. That's all of you here. The work that you guys do every day is so important to the success of the pharmacy, regardless of your role, whether you're working a point of sale, you're in the IV room, you're a medication access coordinator, whatever it may be, your role is so important in the success of the pharmacy and ensuring that our patients are properly cared for and really elevating that standard of patient care. So we'll go through some learning objectives here. First one being, describe the different ways in which a pharmacy technician supports the overall pharmacy enterprise. So it's kind of convenient that Zach and I actually got to switch because a lot of what I will talk about in the first part of my presentation will echo a lot of what you mentioned as well, so that kind of worked out pretty well. Second, we will provide some real-world examples where pharmacy technicians have shined and excelled in dispensing error preventative workflow tasks that enhance patient care. And third, we'll discuss the expanding roles of technicians and how involvement in leadership roles gives opportunity to decrease medication error occurrence by propagating safe dispensing to their field. That's pretty wordy. Basically, we'll take a look and see what leadership roles and things are out there for technicians to help them continue to enhance patient care. I'd be remiss if I missed the Pharmacy Technician Code of Ethics. Certainly won't read through all of these. You guys are very well versed in all of them. So, before we jump into our learning objectives, I really want to take a few minutes to talk about what is a culture of value. So you can see the image up on the screen here. We have our two kind of keywords here, safety and culture, and surrounding them are a bunch of other keywords, things like communication, recognition, leadership. I could probably throw a few more in here, morale, attitude, beliefs. Really, to me, a culture is one's beliefs and one's attitudes towards what they represent. And I think a lot of these words, especially communication, teamwork, those types of things, if we can believe those in ourselves and then inspire our team around us to do the same, that's really what's going to create that culture of value. And ultimately, in the pharmacy, that's what's going to really enhance our patient care and really elevate everything to where we're doing the best that we can to take care of the patients that we have. So why is it important? I kind of put a little math equation here, I guess. But collaborating together, communicating together, really focusing on that patient care, being willing to and open to report your mistakes. But beyond just reporting, owning them and learning from them. I'm a huge proponent of continuous learning and taking any type of error or mistake, owning it and flipping it, make it a learning opportunity. And then active listening, both to your patients and your colleagues. Take that second to really listen to each other. I think that active listening is probably one of the biggest components of communication in which you don't really have to say anything at all. It's just taking it all in and really getting down to what each other has to say. And if you put all of these things together, the results for our patients is going to be that increased patient care and safety. We're all healthcare workers here. We all got into this profession for a reason, and that's to help our patients. And by using all of these things and creating that true culture of value where everyone values each other, values the teamwork, communicates well together, that's just going to benefit our patients in the end. All right, so jumping into the first learning objective, and here's where we'll start to see some similarities between my presentation and what Zach had just mentioned to us all. So how do technicians support the pharmacy overall? First and foremost, providing that extraordinary patient care. We all go above and beyond every day to care for all of our patients. And it's something that we continue to do and build those positive working relationships with them. Order entry, maintaining patient profiles. It kind of goes without saying. We want to make sure that we're keeping accurate information on the patients that we're seeing. Accurate dispensing and compounding of medications. Again, goes without saying. We want to make sure that we're dispensing the right medication to the right patient, right dose, all of that stuff. Inventory management. It goes beyond a little bit more than just keeping medications on the shelf. We obviously have to keep our pharmacy stocked so that we can dispense our medications to our patients. But even more so beyond that, it's keeping the right type of inventory in stock. Pharmacy is a business as well. We have to make sure that we're keeping that in the back of our mind too. Vaccinations. I know we've heard a lot about vaccinations already today, and I think this is so important. And I obviously the pandemic is not a good thing, but it did open a door to allow technicians to get certification to administer these vaccines. Been fortunate enough to work alongside, I think we have 12 certified technicians in our pharmacy right now. My arm was nice and sore for a while, but we got a lot of good practice in, and I'm happy to say that we have quite a few technicians that are willing to jump in the front lines and help administer those COVID vaccines. And of course, the list goes on and on and on. And I'm not going to read through everything here, but really looking at this list, things like answering patient phone calls, running point of sale devices, compliance packaging, things that may seem kind of menial, I guess, and monotonous in the day-to-day, but they serve a very specific role, and they're all very important to the success of the pharmacy and the continued expansion of the roles that all of you guys can do. And finally, putting everything together, I think what's most important to recognize here is that pharmacy technicians, all of you are stewards of safe medication practices that enhance that patient care. So really, everything that we've talked about so far kind of embodies all the different roles that you do to come together to really be that steward for safe medication practices. All right, quick checkpoint. See if everyone's paying attention. So how do technicians support the pharmacy? I'll get a show of hands. I think the answer is obvious, but A, inventory management. B, order entry and maintaining those patient profiles. C, vaccinations. D, accurate dispensing of compounding and compounding of medications. Or E, all the above. Yes, I would hope everyone would say all the above. Well done. So now we'll kind of take all of that, knowing like the culture conversation we had in the first few slides, really taking that, keeping it in the back of our minds as we examine the roles of a technician and how they really elevate that level of safety for our patients. So why is patient safety important? This should be a pretty staggering statistic here, but according to the FDA, there's over 100,000 reports of suspected medication errors each year. 100,000, that's a lot. And that's just what the FDA knows about. That doesn't take into account things that aren't reported, near misses that may not be treated the same way. This number is probably very falsely low. One thing that I think is important, we'll go through some of these common medication errors here, but things like overriding your medication use safeguards. We have barcodes for a reason. There's barcodes on our labels, there's barcodes on our bottles, they're even on patient wristbands on the inpatient side. When you're stocking medications, we have different medications that can sometimes be mixed in the same drawer. We all know that prescription bottle or drug bottles look the same, similar labels, similar colors, look alike, sound alike medications, even NDC numbers that are only 1 or 2 digits off from each other. And so it really takes a keen eye for some detail to really make sure that we're getting things correct. Dispensing machines filled with the wrong product. This could be a pretty big issue, and we'll actually look at a case study here in a little bit that goes through this. Failure to pay attention to the product label. There's so much important information on all of these labels. We want to make sure that when we're labeling things that everything is how it should be, it's clear, it's easy for the patient to see, and everything is how it should be. And I won't go through the rest of this, but really, I think the overall common theme when looking at these medication errors is understanding that a lot of these are preventable. These are things that, I understand we're hectic and things are busy and crazy times and everything right now. Take that extra second. Really take a quick moment to double check everyone's work. Myself as a pharmacist, I have to do this myself too. We oftentimes get caught up in, the hustle and bustle of everyday activity, but just take that extra second, and I bet that 100,000 number would go down. So what's the impact of these medication errors? So the Institute of Medicine put out its landmark publication called To Err is Human. Now granted, this is about 20 years old now, but a lot of this really started to spark some systematic change as far as how we view medication errors in the healthcare system. So the Institute of Medicine, 20 years ago estimated that there was about 1.5 million patients every year that are injured by medication errors. Like 1.5 million, that's a ton. That's what, 3 times the size of Omaha? That seems pretty crazy to me. And then further than that, each year between 7,000 and 9,000 patients die as a result of a medication error. And that doesn't even come close to the financial implications. $40 billion is the cost for helping maintain these patients. You can see some of these statistics, they're a little unnerving, and knowing that a lot of these medication errors are things that are preventable. And so again, it kind of goes back to what we talked about on the previous slide, and really, taking that extra second to make sure, because as, usually, as a technician, you guys are the last line. You're handing those medications to the patient. You're taking your medication history, all these things. Your role is so important in helping limit these numbers and make them as low as possible. All right, this is kind of a busy slide, but really, what are the roles that a technician can play in helping enhance this patient safety and minimize these errors? One thing that I found and I try and preach is always use those 5 rights. You want to make sure we have the right patient. Of course, we want to use at least 2 patient identifiers with every patient that we have an interaction with. Name, birthday. I'd wager a guess most patients don't know their medical record number, but if they do, kudos to them. Right medication. Seems self-explanatory, but there's, as you guys know, there's a lot of different salt forms of medications out there. Tablets versus capsules, all kinds of stuff. And it seems rather simple, but it could get, pretty in the weeds pretty quickly by selecting the wrong medication. The right dose. This one's very important. And we see things all the time. I've read countless case studies of patient gets a prescription for lisinopril 1.5 tablets by mouth once a day. Well, they don't see that decimal point in there, and they take 15 tablets a day. So things like that something so simple as typing the words 1 1/2 rather than 1.5. It takes, 2 seconds extra? But now you've potentially saved someone's life. That can have a huge impact. The right route of administration. Is it by mouth? Is it intranasally? In the left ear, in the right eye? All these things matter. And then the right time. Is the frequency of the dosing correct? Is it take 2 tablets by mouth once a day or 1 tablet by mouth twice a day? Those things can get easily confused. So really using these 5 rights with every prescription that comes across our countertop, our computer screen, anything, just kind of keeping these things in the back of your mind will really ensure that with every interaction that you have or every prescription that you work with, you're doing it correctly. Patient communication and education, this one's huge. Always want to make sure we're asking those open-ended questions. Things like, what questions do you have for the pharmacist? Rather than, do you have any questions for the pharmacist? Make sure we're not eliciting a yes or no answer from our patients. We want to get our patients talking. We want to get them engaged in making decisions and talking with them through how to use their medications, or if you're taking a medication history. I can think back to a time when I was an intern. I remember I was counseling, it was a patient's mom. I was counseling her on how to use a Z-Pack. We're all familiar with the Z-Pack, 2 tablets on the first day and then 1 on days 2 through 5. And I'm going through my spiel thinking I'm super intern. And get to the last bit, I'm like, do you have any questions? Just kind of, nope, don't have anything, Patient went on their way. About half an hour later, we received a phone call from this same person. Hey, I don't know how to do any of this. And I was kind of taken aback by it because, we had spent quite a bit of time going through this, and I was, playing my intern role, and I'm thinking, like, yes, I hit every side effect, every little subtle nuance that this patient needed to know. But in the end, I didn't ask those engaging questions that really got them talking and got them involved in it. The questions I was asking as I look back were very yes or no oriented. You never know if the patient's completely, understanding of it. A lot of times, a quick no is an easy answer. And so taking the time to really focus on those types of things will really, really go a long, long way. Next is adapting to an ever-changing healthcare landscape. Obviously the last year and a half, things have changed and changed very quickly. So we've all had to adapt to something new, just in light of the pandemic, really. So how do we keep up with a lot of this changing information? Things like doing continuing education, attending conventions like the one you're at now, additional training opportunities, really just working with your respective teams to make sure that you have all the information necessary, because again, at the end of the day, ultimately it's your patients that we're here for. And kind of to summarize that last box over on the right side there, double check everything. Take that extra second. If something seems unclear, don't hesitate to ask questions. There's never a bad time to ask a question. As a pharmacist, I would much prefer, if I'm in the middle of 50 different things, I would much prefer to take a second to answer a question than put a patient at risk of something. And finally, if you see something that doesn't look right, it probably isn't. Speak up. You guys have a voice, and your voice does matter. We'll touch on some slides here in a bit, but really, throughout the day-to-day, when you guys are working, if something doesn't seem right, it may not be right. So make sure you guys are speaking up. All right. So now we'll move into some real-world examples of how pharmacy technicians have shined and excelled in dispensing error preventative workflow tasks to further enhance patient care. So another study here. This one is between technicians and physicians, actually. So when I was doing my research for this presentation, I came across this study, and I thought it was really interesting. And it really focused on prescription transcription. So making sure orders are entered correctly, everything. And they looked at a variety of different factors, but overall for technicians, there were 654 items that they transcribed versus physicians who had transcribed 678. It's about the same amount. And you can see the error rates there, in that technicians only had a 3.8% error rate versus an 18.7% error rate. That's a pretty big difference. And again, not to put down our physician colleagues at all, and also to kind of echo what Zach had mentioned in his previous presentation. As technicians, all of you are specifically trained in taking down this type of information. These are things that you do on the daily, and you do them very well, and as evident by this study here. So we'll look at a case here of some automated dispensing. And so I'll read through this little case study. So a technician was refilling cells in an automated dispensing robot. When refilling the cell containing carvedilol, 12.5 milligram tablets, they noticed the cell contained a small amount of tramadol, 50 milligram tablets. Obviously, we know that those are very different medications. Carvedilol used for heart rate and blood pressure, whereas tramadol is used for pain. But although the tablets had different imprints on them, both were small, white, and round. So to the untrained eye, they kind of looked the same. This technician had the courage to speak up, and it was determined that a return to stock bottle, that tramadol had actually been dumped in the carvedilol cell. We went, did some research, all tramadol tablets were accounted for. Everything was all good to go. But what are some takeaways from this? Minimizing distractions. Pharmacies are busy places. We have patients coming to the counter. We've got phones ringing. Music might be playing. Whatever it may be, we have a duty, again, to our patients to help minimize those distractions so that we can ensure that we're doing everything that we're doing accurately. Using your safety measures. We have barcode scanners. Using a second set of eyes. Here's where that TPV or tech product verification will come in handy. And then really just being diligent in recognizing these errors and speaking up to their recognition. Mailing. This is something that has been, in the last year and a half, I think most pharmacies across the country have really, increased their mail-out volumes. Obviously, with COVID, we want to minimize foot traffic and things coming in and out of the pharmacies to keep ourselves safe. But here, a mail technician was packaging some tacrolimus 0.5 milligram capsules. They noticed the name on the bottle did not match the name on the monograph receipt. So they ended up finding the corresponding bag that contained tacrolimus 0.5 milligram capsules for the other patient, and it had, in turn been switched around. So upon further investigation, these two meds were the same, but they had different directions. So if this mail technician hadn't caught that error and hadn't been really good about paying attention to the name on the bottle, the name on the label, the name on the monograph, everything, these two patients stood to potentially take the wrong dose of a very important medication. It's a transplant med. If somebody misses a dose of this or they take too much or too little, it could really throw off their levels and you put them in the hospital, and that could be bad news. Again, though, through attention to detail, they were able to switch these bottles and monographs appropriately, and the patient was taken care of. Again, some takeaways here. We want to obviously, pay attention to those small, subtle details and make sure that everything that we're doing is accurate. We have the right bottle, right label, right monograph, everything. And then always manage one prescription at a time. It's never a good idea, to have a counter full of different bottles and different labels and patient information. It's inevitable, that something will eventually get misplaced. And then use those 5 rights, the right patient, right medication, right dose, right frequency, everything. You make sure we're always using those in the back of our mind. And here, medication allergies. These are important here. So we'll take a look at this one here. So a technician was entering an order for a patient's Augmentin. So while entering that prescription, they reviewed the pertinent patient notes and discovered the patient had an allergy to penicillin. So they consulted the patient's electronic medical record and noticed that allergy information was outdated and did not include penicillin. So they clarified this with the pharmacist, who then contacted that patient, and they confirmed that there was indeed an allergy. So they in turn then contacted that prescriber's office, and the order was changed to something more appropriate. So here, some key takeaways. Obviously, accurate maintenance of a patient's profile. Want to make sure we have the most up-to-date information. It's helpful if you have an electronic medical record, but here we can use our patient as our advocate as well, and reach out to them if there's a question. It's never, like I said, it's never a bad time to ask a question, even if it's to a patient. Again, attention to detail and thorough review of all information. And finally, speaking up on behalf of that patient. If this were a significant allergy, it stood the chance to have the patient have a pretty significant allergic reaction. So all of these things, really, to put it all into perspective, as frontline healthcare workers, pharmacy technicians, all of you are truly in a position where you can really make a positive impact on a patient's life. It could be something as simple as switching monographs around in a bag, verifying that allergy, making sure when you're dispensing your medications, there's 30 tablets versus 90. Those types of things can really, they seem small, but they make a huge impact on the lives of all the patients that you guys serve. All right, another checkpoint. So which of the following are ways technicians can help minimize medication errors and enhance patient care? So A, using the 5 rights. B, asking open-ended questions when engaging patients. C, asking those clarifying questions if something is unclear. Or D, all the above. All the above. Well done. And so now we'll get into a little bit more on how some pharmacy technician roles are expanding. So according to the Our Voice Pharmacy Technician Journaling Initiative, there were 74% of study participants who said that their role as a technician has expanded since their career began. Some examples of this include increased involvement in management roles, supervising other technicians, being an evaluator, trainer, coaching, the list goes on and on. Here's a big list here. Again, I won't read through all of this. We had a really nice intro into the CPHT advanced roles here, but other types of roles, things like your medication access coordinators, being a pharmacy purchaser, senior technicians, meds to beds, 340B analysts. There's so much more that I think goes beyond what I think the public really sees in technicians really just counting tablets or typing an order or answering a phone call. I think there's so much more out there that really advances the profession even further. All right, moving on then to our last objective here. So how does involvement in leadership roles give pharmacy technicians the opportunity to decrease medication errors? All right, so leadership roles. What can technicians do to ensure their voice is heard? First thing I have on my list here is department committees. Now, this might not be something that all pharmacies do, but I'll use our pharmacy that I work in as an example. We have our Pharmacy Advisory Committee, which is a committee of frontline workers who work on the floor. It consists of technicians, interns, pharmacists. Really, they act as a liaison between those working in the pharmacy and upper management. If there's a workflow that needs to be improved upon, if there's something that can be made more efficient, we have people on the floor who are able to see these things and then report them on up the chain. What's really interesting about our advisory committee is that we actually have a technician who is running the whole thing. I'm not going to put her on the spot, but she's here. But she works with these pharmacists and kind of directs them and delegates tasks to them. And really, to me, it's empowering to see a technician take on a leadership role, where they oversee a pharmacist or they oversee an intern or something, and really helping make the pharmacy just day-to-day stuff more efficient. Culture committee, that's the next one on my list. That's another one that we have here where we really, we strive to be as inclusive as possible and make sure that everyone has a voice at the table. Everyone is welcome and able to participate in everything we're doing. And then medication safety committees, really focusing on how can we improve or make improvements to our workflow to help minimize the risk of errors leaving our pharmacy. Continuing to promote safe medication practices throughout the pharmacy. That seems pretty vague, but I think we've kind of seen quite a few examples, in the last little bit here of how technicians can promote different safe practices using your things like your barcodes or your tech check tech, all that type of stuff. Seeking those advanced opportunities through additional certification and certificates. Getting involved with Board of Pharmacy approved initiatives, and then becoming a mentor or mentee program. One thing that I've done is, in my pharmacy here, is we've created a senior tech role where it isn't a senior tech in the true semblance of what I think a lot of people really realize, in that they have advanced roles, but they're more seen as a resource and a mentor to others. And they're kind of that presence within the pharmacy where if anyone has a question or really, wants to learn some more, we have additional resources available to anyone in the pharmacy where they're able to go to. And it's just nice having these extra mentors, so to say. And finally, your voice matters. As technicians, I really, I want all technicians to advocate for their profession, advocate for things that you guys want to do, different opportunities, different ways to continue to promote yourselves, promote safety, promote the patients that you serve every day. I truly think that, as technicians, you guys are the ones that make the pharmacy work. And if something doesn't work, speak up. Let's make it work together. And then moving into our last checkpoint here, kind of see a theme with the answers to the question, but the roles of the pharmacy technician continue to expand. So which of the following are advanced technician roles? Medication access coordinator, emergency department medication reconciliation, purchasing analyst, sterile and hazardous compounding, or E, all the above? All the above, all right. So a quick summary then. So overall, taking everything from the presentation and really diving in, how is it all put together? Starting back with our culture, how does creating that culture of value among technicians really continue to enhance patient care? Letting your voice be heard. I've said it a few times already, but really being an advocate for you and your patients. Advancing your career through different educational opportunities and certificates. increased communication amongst the team, collaborating with others, focusing on that patient care, again, being willing to be open and report your mistakes and learn from them. And then finally, getting that recognition for a job well done. I think a lot of times pharmacy technicians, it's kind of a thankless job, and from one pharmacist to a whole group of technicians, thank you. The work that everyone here does is so important in really making the pharmacy work and really being there for our patients. So with that, I will open it up for questions.